We begin tonight with breaking news involving LA County Public Health Director Dr. Barbara Ferrer. A study cited by the CDC showing masking and other mitigation efforts in LA schools were, quote, highly effective in slowing the spread of COVID and influencing school masking policy across the country was co-authored by Caitlin Barnes. She's the daughter of LA County's Public Health Director Barbara Ferrer. But that relationship was never disclosed. The possible conflict of interest revealed in this new report in red state. This comes just days before LA County is set to become the only California county to reinstate its indoor mask mandate amid a new rise in COVID cases and increasing hospitalizations. We do want to bring in the journalist who broke this story, Jennifer Van Laar. Here she is. She's from the Red State. It's a conservative news source. Jennifer, thanks so much for being with us tonight and in studio.
Thank you for having me.
All right. How did this come to light? How did you make the connection between Caitlin Barnes and Dr. Barbara Ferrer?
Well, I got a tip from some people that had seen this article, the CDC study, and asked me to look into it. And they were alleging that Caitlin was Dr. Ferrer's daughter. I had done some stories about Ferrer back in 2020 and knew that she did have two children and that was, in fact, her daughter's name. So then looked at the video from the Woman of the Year ceremony that was recently held here in LA County, and Dr. Ferrer thanked her daughter by name.
Well, we did reach out to the health department hoping to get a statement from Dr. Barbara Ferrer, and we did receive a statement. We want to read that in full to you. It says this. The study was conducted by multiple experienced public health infectious disease experts and epidemiologists in partnership with the Los Angeles County Office of Education. It came to the same conclusion as dozens of other studies from around the world, which is the masks are effective at slowing the spread of COVID-19. Dr. Ferrer had no involvement in this study whatsoever. The research was led and carried out by respected DPH professionals and a partner agency. Now, to be fair, Caitlin Barnes is one of 5 who are listed as co-authors on this study, so there is that point there, is it not?
Well, that's true. She is one of 5 people listed on there, only one of whom is a medical doctor. The others have master's in public health degrees. And if Ferrer had no involvement, then why is she listed on the acknowledgments by name?
And also, I do have the study right here, and to your point, there is an option for them to disclose any conflicts of interest, at which point they don't.
Correct. And reading through the author submission guidelines from the CDC, this relationship between her and her mother should have been disclosed because the department that her mom leads is the partner agency with her agency on it.
Yeah, and Caitlin Barnes, she has her Master of Business Administration, so you point out that she is not a medical doctor, neither is Barbara Ferrer. She has her PhD in social welfare and Master's in public health. Why is this such a big deal? Why should the public care about this relationship?
Well, because it smacks of a conflict of interest. You know, why is her daughter suddenly getting this job in the public relations office at LA County Office of Education, December of 2020, I believe it is, when she started, you know, after the pandemic, and then immediately goes into doing this study that then is used to justify the mask mandates that her mom wants to have. And you could debate it, I guess, but she seems like she really does want to have the mask mandates back.
Well, to your point, she will be the only health director in the state of California to reinstate the mask mandate because now that we're in high community transmission here in LA County, as is the case through multiple counties, 41 at last check of the 58 in high transmission, and not one public health director has decided to reinstate that indoor mask mandate. That's likely going to happen on July 29th here in LA County. Have you actually talked to Barbara Ferrer throughout this report?
No, I have not.
On your behalf?
I have not talked to her.
Have you?
I've reached out to their office on multiple occasions on different stories I've written about her and filed Public Records Act requests, and I never received a response.
Never?
Never.
Never even just a statement?
Correct.
Why do you think that is?
I don't want to speculate about that.
Well, also in your reporting, you say that really this relationship is an open secret among many county employees. One of the county employees who is a friend of this show is LA County Supervisor Catherine Barger. She says today that she did not know about this relationship between Caitlin Barnes and Barbara Ferrer, didn't know that her daughter worked for the county. And in fact, we didn't point out yet that Caitlin Barnes, she works for the County of Education, I mean, the Office of Education within LA County. So we do have a statement from Supervisor Barger. It reads in part, I support transparency. I also believe that recommendations by federal public agencies like the CDC are based on a full literature review of topics, not just one report. She goes on to say that she doesn't support mask mandates, which is no surprise because that's her stance all along for the most part. Where do we go from here? Is this really an open secret within the county health department?
Well, she seemed pretty comfortable acknowledging her daughter at that luncheon at which all the supervisors were. I don't know what was disclosed on her job applications or throughout that, or how much contact the supervisor's office has with Ferrer or that office to know. I do know that her daughter could have just not been part of the study and then just avoided this whole thing. Also, Dr. Rochelle Walensky named this study last August in a White House press briefing as part of the reason that they were encouraging schools to have these mask mandates. And
Dr. Rochelle Walensky is the CDC director, the head of the CDC. So what does that say to you?
It says that it was pretty influential. That, as Dr. Barger said, hopefully that these recommendations are based upon a full review of the literature, but this was the one study named by Walensky.
Where does your report go from here, your reporting go from here?
We're going to be following up with these statements that I just became aware of, and further reports will be at Red State.
Well, your story broke on the eve of what is the weekly LA County Department of Public Health briefing, which I've been a part of really since March of 2020. I've taken part in nearly all of them where I usually get called on. So my question to Barbara Ferrer tomorrow will be, why didn't you think this was a good idea, necessary to reveal the relationship and disclose that personal relationship? So stay tuned. Jennifer Van Laar, thank you so much for being with us tonight.
Thank you.
And your reporting.